Good afternoon. I'm Audrey. I'm the nurse in Medical Assessment Unit, and I would want to hand over my patient, Carol Young. Are you the nurse from Ward 29?
Hello, yes, I am. My name's Rebecca. I'm one of the nurses from Ward 29.
Lovely. Rebecca, are you happy to receive my handover now?
Yes, please.
Lovely. So, as I've mentioned, we've got Carol Young, who has a date of birth of 24th of November 1940, and her address is 1 Pine Street, Berwick upon Tweed, TD 155PP. And her GP is Dr. Ali Beaumont Surgery in Berwick upon Tweed, and her hospital number is 0004321. I am handing over Carl Young because she was admitted with acute exacerbation of asthma and has now been referred to asthma nurse for management. So the doctor ordered her to be admitted and monitored for the next 24 hours in your unit Ward 29 as her chest x-ray shows consolidation in the right lower lobe. Thus, I'm doing this handover. Are you happy for me to proceed?
Yes.
Lovely. So, as I've mentioned, Carl was admitted earlier today, presented with a shortness of breath, and currently receiving 10 liters of. Earlier, she received 10 liters of oxygen via non-rebreather mask. Carl has been diagnosed with unstable asthma as well and is being monitored on the medical assessment unit. Carol has not been mobilized due to her breathlessness. So when mobilizing, she quickly becomes breathless. We referred her to physiotherapists and occupational therapists as well to provide suitable ambulatory device and any exercises that would help her breathe better. She also struggled sleeping due to breathlessness when she's experiencing breathlessness. So it might be helpful to probably, when it's bedtime, check on her if she needs 1 or 2 pillows, so she could sleep properly and safely. Carol is also very worried about her husband being at home alone, as he has end-stage COPD on home oxygen. So I will tell you later the interventions that I have done. Past medical history, she has underactive thyroid or hypothyroidism, and she also has asthma. Social history, she's a smoker. She drinks minimal alcohol. She is married and lives with her husband, and she is a retired hairdresser. She's normally mobile and keeps active, but unfortunately, with her asthma and breathlessness, she has a limited or restricted mobilization at the moment. She is usually a normal diet. She has 3 grown-up children who don't live in the area. The drug history or the drugs she usually takes is levothyroxine 12.5 microgram once a day and paracetamol 1 gram as required. The allergies that she has is latex, and which that causes rashes as well when she has any contact with latex.
Okay.
Earlier, when we were assessing her, I've got a set of observation and she scored a NEWS2 of 5, but I will give you the latest observations as well. So earlier in assessment, she was having a temperature of 38.4, but now that's gone down to 37.3. Pulse rate earlier was 90 beats per minute. Now it's 92. Earlier, the respirations is 23, was 23, but now it's at 20. Earlier as well, she was at 97% with the assistance of 15 liters of oxygen in non-rebreather mask, but now it's 95% on room air. And earlier as well, her blood pressure was spiking to 145/90, but now it's at 108/59. And her current NEWS2 score is 2, which requires 4 to 6 hourly monitoring. The main nursing needs that I have identified earlier was her shortness of breath and her temperature or elevated temperature. The nursing intervention I've done for elevated temperature is that I've checked if there's any paracetamol or antipyretics due. I've advised her to drink plenty of fluids as well for hydration. And if tolerated, I opened the windows and the doors as well for ventilation with the patient's consent. And I advised Carol as well not to overlayer on clothing just to promote thermoregulation. As for the shortness of breath, I have constantly or regularly assessed for abnormal breath sounds as well. Referred her to a lung specialist or respiratory specialist for any further assessment. I have repositioned her to an upright position just to promote um, or for lung capacity, which better aids her in breathing. I have administered oxygen therapy as needed as well. And as for the medical interventions, earlier at 12 noon, she was given, or in her prescription, at half 10 in the morning, she was given salbutamol um, to relieve for asthma, rather. So she's taken that. Azithromycin, that was given to her as well at 12 noon for her chest infection. She was given Montelukast as well, 10 milligram at 12 noon. And as for the PRN, there's no other PRN given to the patient. My other areas of concern would be her mobility in terms of like walking. Because normally she walks independently, but now she has a restricted movements. And since she has a consolidation too on the right lower lobe, so we want to make sure that the exercises that she's allowed to do is safe for her as well, whether that's going to mobilize the liquid or the fluid in her lungs, whether that's going to come out through coughing um, or something else. And what else? And also, one of my concern is her worry about her husband being left alone at home. Having said that, my recommendations is to continue the 4 to 6 hourly monitoring for Carol and to ensure that her temperature is kept within normal range and that her shortness of breath is addressed as well following the nursing interventions in the care plan. And also, if you could refer her to, when she is discharged, maybe refer her to social worker just to maybe assist her or occupational therapist, and maybe ring the next of kin or one of her children just to see if they can have a look and check whether her husband is okay to be left at home, or is there any package of care or assistance that we could provide on our end as well to the husband while Carol is admitted. Other than that, I think that's everything I need to hand over. If you need any information, you could ring me in the medical assessment unit. And are you happy with my handover?
Yes, thank you.
Perfect. And that's it. Thank you.
Thank you.